Clinical manifestations of multiple sclerosis. The onset of multiple sclerosis, it might be abrupt or insidious, that is, it might be sudden or it is a slowly progressive form, and symptoms are so trivial, that is, symptoms patients might be asymptomatic during their lifetime, and sometimes in autopsy 0.1% of the individuals, they might be having multiple sclerosis, and sometimes an MRI, if it is done for an unrelated reason, it shows evidence of asymptomatic multiple sclerosis. So the symptoms of multiple sclerosis are extremely varied. So these depend on the location and severity of lesions within the central nervous system. So onset of multiple sclerosis is abrupt or insidious, that is, it is sudden or it might take a prolonged period of time, and patients might be asymptomatic throughout their lifetime, and if autopsy or MRI, if it is done for an some unrelated reasons, then we can see the lesions of the multiple sclerosis either on autopsy or MRI if it is done for an unrelated reason. Symptoms are extremely varied and they depend on the location of the lesions, and they depend on the locations and also on the severity of lesions within the central nervous system. Sensory symptoms of multiple sclerosis. So the sensory symptoms include paresthesias, tingling, prickling sensations, pins and needles, or hyperesthesias, that is reduced sensation, numbness, or a dead feeling. So sensory symptoms either can include paresthesias, tingling, prickling sensation, pins and needles, or hyperesthesias, reduced sensations, numbness, or a dead feeling. So paresthesias or hyperesthesias. Sometimes unpleasant sensations are also common, that is, sometimes as if your body parts are tightly wrapped are also common. And if there is a sensory impairment of the trunk and if there is a sensory impairment on the legs, there will be a certain horizontal line on the torso. So this indicates that spinal cord is the origin of the sensory disturbance. So sensory impairment of the trunk and legs below a horizontal line on the torso. This indicates that spinal cord is the origin of the sensory disturbance, and it is often accompanied by a band-like sensation of tightness around the torso. And pain, it is also a common symptom of multiple sclerosis, and it is experienced by greater than 50% of the patients, and this can occur anywhere on the body and it can change locations over time. So sensory symptoms include paresthesias and hyperesthesias, and sometimes unpleasant sensations like feeling that body parts are swollen, wet, raw, or tightly wrapped are also common. And there also might be sensory impairment of the trunks and legs below a horizontal line on the torso, and this indicates that spinal cord is the origin of the sensory disturbance, and this is often accompanied by a band-like sensation of tightness around the torso. There will be a band-like sensation of the tightness around the torso. And pain is a common symptom of multiple sclerosis. This is experienced by greater than 50% of the patients, and this can occur anywhere on the body, and this can change locations over time. Optic neuritis is the other symptom. So this optic neuritis, because you're fresh from your final year part 1, you'll be better knowing. Okay, optic neuritis presents as diminished visual acuity, dimness, or there might be a decreased color perception, desaturation in the central field of vision, and these symptoms can be mild and sometimes they might lead to severe visual loss, and rarely there is a complete loss of light perception. Rarely complete loss of light perception will be present. So symptoms are generally monoocular, that is limited to one eye, but they may be bilateral. Periorbital pain aggravated by eye movement often precedes or accompanies the visual loss. So periorbital pain will be present. It will be aggravated by eye movement. So it will be present before, or it often accompanies the visual loss. So optic neuritis, it can progress to severe visual loss. Okay. And because optic nerve is involved, an afferent pupillary defect will be present. And fundoscopic examination, if you do fundoscopy, what will you see? A normal or optic disc swelling, papillitis. So pallor of the optic disc commonly follows optic neuritis due to optic atrophy. In optic atrophy, there will be pallor of the optic disc. And uveitis and all are uncommon. If uveitis is present, then it should raise a possibility of alternative diagnosis such as sarcoid or lymphoma. Uveitis is uncommon. If it is present, it should raise the possibility of alternative diagnosis such as sarcoidosis or lymphoma. Next symptom is weakness of the limbs. So this manifests as there will be loss of strength or a disturbance of gait. And the characteristic symptom of multiple sclerosis is exercise-induced weakness. Okay, characteristic symptom of multiple sclerosis is exercise-induced weakness. So this weakness is of upper motor neuron type, and it is usually accompanied by other pyramidal signs such as spasticity, hyperreflexia, and Babinski's signs. And sometimes a tendon reflex may be lost. So this indicates a multiple sclerosis lesion is affecting the afferent reflex fibers in the spinal cord. So weakness of the limbs manifest as loss of strength, speed, or dexterity, and exercise-induced weakness is a characteristic symptom of multiple sclerosis. This weakness is usually of upper motor neuron type and accompanied by other symptoms such as spasticity, hyperreflexia, and Babinski's signs. Occasionally a tendon reflex may be lost, and then it indicates that multiple sclerosis lesion is affecting the afferent reflex. Facial weakness might also be present in multiple sclerosis. This is due to a lesion in the pons. Spasticity is also seen in 30% of multiple sclerosis patients. They might have moderate to severe spasticity, especially in the legs. Next symptom is visual blurring. So this visual blurring, it either results from optic neuritis or diplopia. So diplopia, it results from internuclear ophthalmoplegia or from palsy of the sixth cranial nerve. So what is this internuclear ophthalmoplegia? It consists of impaired adduction of one eye. This is due to a lesion in the ipsilateral medial longitudinal fasciculus. Internuclear ophthalmoplegia, it is due to a lesion in the ipsilateral medial longitudinal fasciculus. It consists of impaired adduction of one eye, and there will be prominent nystagmus is observed in abducting the eye along with a small skiv deviation. And a bilateral internuclear ophthalmoplegia. Bilateral internuclear ophthalmoplegia, it is suggestive of multiple sclerosis. And other common gaze disturbances include a horizontal gaze palsy, 1.5 syndrome, that is horizontal gaze palsy plus internuclear ophthalmoplegia, and acquired pendular nystagmus. So the other common gaze disturbances include a horizontal gaze palsy, 1.5 syndrome, horizontal gaze palsy plus internuclear ophthalmoplegia, and acquired pendular nystagmus. And ataxia is also the another symptom of multiple sclerosis. It usually manifests as cerebellar tremors. And this ataxia involves the head and neck or the voice producing a characteristic cerebellar dysarthria, scanning speech. And vertigo might also be present from a brainstem lesion resembling acute labyrinthitis. And hearing loss may also occur in multiple sclerosis, but this is uncommon. So finally, the clinical manifestations of multiple sclerosis might be abrupt or insidious, and symptoms might be so trivial that patient might be asymptomatic during his lifetime. And sensory symptoms include paresthesias and hyperesthesias, and optic neuritis manifest in the form of visual acuity, dimness or decreased color perception, and later it progresses to optic atrophy. And weakness of the limbs with upper motor neuron signs, facial weakness due to lesion in the pons, spasticity will be present, and visual blurring will be present either from optic neuritis or diplopia. And internuclear ophthalmoplegia, it is due to impaired lesion in the ipsilateral medial longitudinal fasciculus. And bilateral internuclear ophthalmoplegia is particularly suggestive of multiple sclerosis. Ataxia will be present and vertigo might also be present.